Let's get some help now to try and make sense of what's happening around the world with COVID. And let's speak to Mary-Louise McLaws, who is an infection control expert and also an advisor to the World Health Organization. Welcome to the program. Always great to speak to you, Mary-Louise. Why are we seeing such different approaches from governments, especially during this holiday season, especially because it's New Year's Eve tomorrow and so many people gather, and we have been here before?
Good morning, Maria. Look, I think some countries don't want to actually explain to people in their country that enjoy December, which is the Christmas break or the summer break, or New Year's Eve for everyone around the world, just like they did last year, that they need to actually respond differently. They need to have fewer people to their house. They need to make sure that they've been recently vaccinated, because we've seen at WHO, with experience from many countries around the world, that your neutralizing antibodies from either previous infection or a vaccination starts waning dramatically by about 4 months. So, you need to use rapid antigen tests to ensure, if you're going to have family meetings over the Christmas break or friend meetings over New Year, that you test yourself to make sure that you aren't inadvertently taking an infection with you. And also, Maria, this one has a very short incubation period. So there was a cluster outbreak in the US, in Nebraska, and they've identified that around 3 days is the incubation period for that family cluster, which is, a couple of days shorter, or about 1.5 days shorter than Delta. So it's highly infectious.
Oh, you raised so many incredible points there. But you mentioned the rapid antigen tests. They're running out. Some countries don't have them at the moment, even PCR tests. So how do you go into the holiday, the rest of the holiday season, especially tomorrow, with a lack of them?
Yeah, that's right. So fortunately, WHO has reported that both PCR and a rapid antigen test can be used for Omicron. So that's great. It works. And it just goes to show that most countries haven't thought as outbreak managers that they need to think, what is the super spreading event that's going to happen in their country? Oh, well, in those countries that are Western, it's the Christmas break. In every country, it's the New Year. So let's organize to have more rapid antigen tests so people can test themselves. But sadly, they haven't. And a lot of countries still don't provide them for free to people. Now, the UK do, Singapore does, New Zealand is doing it as well for free. And the US is now talking about providing them for free, because as Dr. Tedros, the Director General of WHO, reminds everybody, test, test, test is the way, of course, and vaccination to try to control any strain of Omicron. So we really do need to use really good rapid antigen tests. Remember, if you've got a symptom, you probably should be using a PCR test, but a rapid antigen test can be used for diagnosis, but they are very good for using as a screening test. In other words, am I really negative? And some of them have very high levels, like 99 to 100% accuracy. But when it says you're negative, you really are.
All right, good if you can get your hands on one of those testing kits. A quick question to you about France, the country that's the worst hit in Europe at the moment. One person is testing positive every 2 seconds, according to the French health minister. Why is Europe, the UK and the US being hit so hard?
Yes. So the UK has about 900 infections per 100,000. France has about 780 per 100,000, and then followed by Italy, which has sort of half that, or 432 infections per 100,000 population. Why? Well, it's the northern hemisphere winter. People go inside. The ventilation isn't very good. wound. Now, if you're going to wear a cloth mask, it really needs to be a 3-layered cloth mask, but please try to change them and use a medical mask or a respirator for this particular strain, and open up your windows regularly. I'm sorry, even if it's cold, if you're going to have people over, because this particular strain would be highly aerosolized because it would appear as if it can get a charge on the outside of its spike, a negative and positive charge, which means it might be able to attract the saliva or lung fluid, surround it and stop it from drying out. So it can actually maybe, this is hypothetical, stay in the air for longer and be still alive. So if you breathe it in, you can get it. And please wear your mask over your nose, because if you breathe it in through your nose, you can, of course, get very sick.
And thank you for that reminder. We see so many people not putting it over their nose sometimes. Mary-Louise McLaws, thank you so much.
Stay safe.